And this is the third video dedicated to the National Congress on Occupational Health and Medicine. So today was a big day for me because I was co-chairing a topic of the Congress dedicated to management and work issues. So I decided to select just three communications because I guess I could be really talkative concerning this, and we will try to have other ways to disseminate research concerning all of this topic in the future. So I will be keeping you up with this a bit later. So the first communication was performed by Pascal Huguetto. It was discussing about the question of managers, and it considered that managers shouldn't be considered just as simple tubes able to convey informations from bottom to top management. In fact, they also have their own abilities, their own skills, and their own opinions on some situations, problematic situations, and they also have the possibilities to solve some of these situations and to give some priority to some troubles and to make some selections concerning working issues and what should be said to top management. The second point of this talk was the ambivalent position of just the immediate manager, the first line of management, just really close to blue collar workers. These kind of managers could be ambivalent because they have to provide some safety message, and it's often done at the beginning of the working day, and that was described by Pascal Huguetto in the public works business sector he studied. And later on, when the working day is going on, they have to provide some other kind of message, much more related to efficacy, productivity, and so on. So there is something really different between safety issues, safety rules, safety is our priority, something, and when everything is late, safety is no more any priority. The priority is to finish work on time. And a final point of this communication is that, well, it's tough, but it's true. In the field of occupational health and safety and occupational medicine, we should do some compromises between what we want as occupational health professionals and what should be done or what will be done in the enterprises, because with stakeholders and occupational health professionals, we have different point of view, different ways to see the situation, and we have different responsibilities. So that's why we should admit that we have some compromises to do and to work with this in head. The second talk I'd like to talk about was performed by Emmanuel de Chatillon. He talked about some different issues concerning management. First of all, he said, and he provided some evidence of that new public management that is used a way to manage public administrations, for instance, these kind of management has some pathogenic sides. Another point that Emmanuel de Chatillon has been talking about is that the question of prevention and occupational health issues in the enterprises shouldn't be secluded. These should be connected, linked with all other fields in the enterprises, all other kinds of policies in the enterprise, because these occupational health issues are not just a separate topic. Everything is linked to, for instance, business, for example, budgets, everything is connected. So it is a big risk we have in the enterprises to make things really, really separate one from each other. The last point I'd like to discuss from this really, really interesting talk was the fact that having some space to discuss in the enterprises is really, really interesting. It's important, and other academic fields have shown the importance of this activity ergonomics, work psychology, but, well, evidence to show that it's something useful for health at the workplace were lacking a bit. And Abord de Châtillon's provided some good and interesting evidence of the efficacy of having good spaces like this in order to have a good impact on emotional and physical exhaustion. So that was quite interesting. The last communication I'd like to talk about was performed by Katia Kostulski from CNAM in Paris, professor of psychology. And this was a two-sides talk with a theoretical part concerning the activity clinics, that is a field of occupational psychology that was developed by Yves Clos in the 90s. And, the main thing I'd like to say about this is that we make a distinction between the realized activity, what is done practically, what the worker is doing, and what we can see as an external observer of the situation, and what we call in activity clinics the activity real, in French, l'activité réelle, and this activity real is much larger than the realized activity, what we're seeing. I try to give the practical example Katia Kostulski has provided to us. When you have a big day working and you are at the end of the day totally exhausted, sometimes you are exhausted because you had a lot of things you were not able to do, to achieve. You did not succeed to achieve the huge amount of work you had to do at the workplace. So you are exhausted because of what you did not do. Not because you did a lot of work, not because you had a lot of things practically achieved during the day at the workplace. No, you can be exhausted because you did not succeed doing things. If you are an external observer, you cannot be able to see this because it's in mind. That is the thickness of activity. That is really, really important because all of this, what you want to do but you are not able to do, has an impact in your psychological life. And this has some bad effects, side effects on both activity. You are not as efficient as you could be if you have all of the things to think about this while you are doing your own activity, and it can lead people to some work-related mental issues. So that was the first part, and the second part was related to a practical intervention they performed in their research team on a operating theater in a hospital in the field of neurosurgery. And so this was the survey Katia Kostulski has chosen in order to illustrate the distinction between two kinds of efficacy: managerial efficacy versus operative efficacy. When in an hospital you decide to increase the rate of occupied theaters because you need to be really, really efficient to increase the number of patients you are taking in charge in the hospital, well, regarding this, you as a manager, you try to perform some mutualization of stretchers. You try to explain to nurses to be able and develop their skills to be able to support a surgery in the field of neurosurgery or ophthalmology or anything like this. And doing this, maybe it's logical from a managerial point of view, but seeing this from the worker point of view, the operative efficacy, well, it's not that good because you have a lack of skills. When you perform some mutualization, you cannot have the same level of skills with the workers. So there is a gap between the managerial efficacy that is related to some prescriptions from some health authorities we have in France, and the practical efficacy. The problem of the worker is not to satisfy the Ministry of Health, it's to have a good operation and to be safe to perform a good surgical act with the patient. So that is the gap, and this could be connected because in both situations it is the question of efficacy. So this kind of discussion space we were just talking before could be a good mean to bridge these two kind of efficacy. Well, I'm done with the communication because as I told, I could be really, really talkative about all of these, and it was really, really interesting. And if you wish, I encourage all of you to read all of these French authors. Some of these published in English. So feel free to have a look on all of this. It's really, really interesting. So have a nice day and see you for the next video.